My name is Samon Birojit Singh. I am the elder brother of Mr. Samon Birojit Singh, who is a patient here in the Narayana Tagore Hospital in Manipur, Kolkata. Actually, my younger brother felt chest pain in the last week of January. So we took a MRI and CT scan in the one of the hospital in Imphal, Manipur. After that, we have contacted a doctor, a cardiologist in one of the hospital in Imphal, and he checked all the reports and had told us to go to outside for your better treatment. And I told the doctor to contact the Narayana Tagore Hospital in Kolkata because I had been here in many times in past. Actually, I didn't go to the hospital, but surrounding I know very well. I came here 2 years back here. So I told him to refer to the Narayana Tagore Hospital, Mukundapur, Kolkata. So they made all arrangement for sending my brother to Kolkata and told us that we have contacted all the what I should say, all the necessary documents we have sent, and you go and there and meet the Dr. Atanu Saha. We came here on 31st January 2021, and my younger brother had been admitted here on the same day in the evening. On the 2nd of February, he had been operated by Dr. Atanu Saha.
Hello friends, this is Dr. Atanu Saha from NH Arctics, Kolkata. We are very proud to share you with a very important piece of information. Mr. Singh, who had come from all the way from Manipur, he was having an acute aortic dissection with a contained rupture, was very sick, had very high expectations of us, and he basically flew in from all the way from Manipur a month and a half back. So we had done an aortic dissection repair on him, and for the very first time in Eastern India, we did a frozen elephant trunk on him. This is an advanced treatment option for patients with an acute aortic dissection, where we put in a stent graft in addition to the aortic repair that we usually do in cases of aortic dissection. So in a frozen elephant trunk, what we do is we tackle the ascending aorta, the aortic arch, as we did before in cases of aortic dissection, which is pretty standardized. For the descending thoracic aorta, what we do is we take the help of a stent graft and we put it antegrade once we are operating on the patient. This is done when the patient is in circulatory arrest, the brain circulation is on, and the circulation to the rest of the body is stopped. We cool the patient and we cut open the aorta, diseased aorta, we resect the area, deploy the graft, and complete the reconstruction procedure of the arch as well as the ascending aorta. We are very proud to share that this has been the first successful frozen elephant trunk procedure done in Eastern India. Patient is doing extremely well. He has come for follow-up a month and a half back. All his cardiac functions are within normal limit. He is actively walking. He has gained body weight, and he's soon fit enough to join his profession. So friends, as I was telling you earlier, aortic dissection is a critical disease which has to be addressed early. Early operation is the only solution in these difficult cases. So patients who are having aortic dissection, who have been diagnosed with aortic dissection, this is my message to the concerned referring physician: please do not delay treatment in these cases. They have to be promptly referred to a physician, a surgeon, or a center where aortic dissection or these critical surgeries are done on a regular basis. Teamwork, support is very important for a successful outcome of these cases. To end, I must thank NH, our team, for extending their support for the recovery of this patient. I wish him well. Stay safe, stay healthy.
मेरा नाम है प्रशांति देवी, और मैं सामोन बिरोजित की पत्नी हूँ। मणिपुर से आए हैं। हम यहाँ बहुत खुश हैं क्योंकि यहाँ का डॉक्टर अतानु साहा ने मेरे पति का इलाज किया ना, तो वो सब आजकल तो बहुत ठीक हो गया। यहाँ आते समय तो हम लोग सोच रही थी ये इतना बीमार है, वो चल भी नहीं पाए ना, तो यहाँ का नर्स भी इतना अच्छा है, वो सब हम लोगों का ख्याल रखती है ना। Thankful to Sir Atanu Saha and this hospital.